We're an evidence-focused health policy channel, and we strongly believe that public policy, particularly policy related to health and healthcare, should be shaped by data, and that's how we feel about abortion. Controversial or not, that's the topic of this week's Healthcare Triage. To begin, there are cases where providing an abortion is a life or death decision. For example, when an ectopic pregnancy occurs or a miscarriage isn't released on its own, an abortion is sometimes necessary or the woman could die. Most people, though not all, agree that abortion should be legal in these cases and in those involving incest or rape. Opinions diverge more when we get beyond these cases. So we're focusing on data that can give us an idea of the health consequences of restricting or banning abortion in general. To the research. One systematic review found significantly increased odds of low birth weight among babies from unintended pregnancies. Among babies from unintended, mistimed, and unwanted pregnancies, odds of preterm birth were significantly increased. Both of these things are bad for babies. And it isn't just the health of the offspring at risk. Women denied an abortion are more likely to experience pregnancy-related complications like eclampsia, and their physical health is more likely to suffer even years after the pregnancy. And finally, unintended pregnancies are significantly associated with increased maternal mortality. These associations are likely due to a number of factors, such as reduced prenatal visits during an unwanted pregnancy. But because pregnancy sometimes results in death, restricting access to abortion inevitably means more pregnancy-related deaths. A 2021 paper estimated maternal mortality rates in the hypothetical case of a total abortion ban and reported that pregnancy-related deaths would increase by an estimated 7% in the first year and by an estimated 21% in subsequent years. Pregnancy is a health condition and it can be risky, particularly in the United States, where the maternal mortality rate is higher than any other wealthy nation. To make matters worse, the maternal mortality rate in the United States is even higher for Black women, which we've covered on the show before. That 2021 paper we just covered estimated that in the case of a total abortion ban, pregnancy-related deaths would increase by 33% for non-Hispanic Black people. Importantly, all of these estimates cover only pregnancy-related deaths, meaning they don't include deaths related to obtaining unsafe, illegal abortions in the absence of a better option. And there are other difficult outcomes for both parents and offspring when abortion access is restricted. Among individuals who underwent abortions in the United States in 2014, 75% were considered poor or low income. In a study following close to 1,000 U.S. women seeking an abortion, those who were denied found themselves confronting increased household poverty for at least 4 years following birth compared to those who were able to access abortion. And for several years afterwards, these women were more likely to lack money for basic living expenses like housing and food. Following this line, their existing children were more likely to suffer as well, being almost 4 times as likely to be living in poverty than the existing children of women who were able to access an abortion. Having children is expensive, and a primary reason given for abortion is being unable to afford to raise a child. Unfortunately, many states passing strict abortion restrictions provide little social support for parents and children. All of this matters because income is a social determinant of health. We've discussed those in the channel before, and the fact is that poverty is terrible for your health, so data like these should matter a lot for health policy. And finally, cutting off access to abortion can make it difficult to escape other life-threatening situations. Women denied an abortion were less likely to cut off contact with an abusive partner. A wide range of people are affected by abortion bans. People of all ages, races, incomes, and religious affiliations receive abortions in the United States. If the goal is to create an environment where the number of abortions is reduced, there are ways to do that without compromising public health. Beyond offering more social support for pregnant people and their families, data also highlight the efficacy of health policies that focus on the prevention of unintended pregnancies in the first place. We can do this by seriously investing in things like sex education and family planning, and by removing financial and logistical barriers to birth control. As it stands, though, the data suggests that radically restricting abortion access in the current environment of the United States isn't really good for public health. If you enjoyed this episode, you might enjoy this previous episode on U.S. maternal mortality is much higher for African Americans. We'd appreciate it if you'd like and subscribe down below, and consider going to patreon.com/healthcaretriage, where you can help make the show bigger and better. We'd especially like to thank our research associates, James Glasgow, Joe Sevitz, Edward Lillaholm, and Brian Nam, and of course, our Surgeon Admiral, Sam.